honor of introducing to you a dear friend, a previous student, and a very important member of the DAMS family, who is actually your favorite ophthalmology faculty, who has taken a step further in the last 3 years by introducing a resident course. And I'm very proud to say that we have got massive response by the ophthalmology residents all over the country who are happy with the theory-based teaching that he's doing. So I thought, why not use this opportunity to pick on his brain and find some tips for the residents. But before I do that, Saurabh, why and how did you decide upon starting this resident course with us?
Hi everyone. Sir, I didn't decide to start this course. Sir, you are taking this interview. Even if you are not, you would not have taken this interview, I would have said this. I didn't choose to start. It was sir who pushed me about 3 years back to start this course. I was very reluctant. I didn't know that we'll get such a response, but we started with very humble beginnings 3 years back. And sir pushed me at that time that why don't we do this? Because at that time, it was COVID time, just after COVID time. And we have just started taking lectures for undergraduate in eMedicoz. So sir said, why don't we start a resident course? And I was very reluctant. I said, why? So I don't think so it will work. And that time we just started with some live sessions, and then it grew. And today, so we have about 4,000 to 5,000 residents with us in the course.
Wow. And Saurabh, now I also wanted to know from you, like many students, they ask me this question. I thought, why not directly ask you that suppose I'm joining my MS ophthalmology today, what should I utilize and what should be my goals of learning, and how does your course help me at that stage of my first year of residency?
So the course which I have prepared is for MD, MS, DNB residents, and also for DO residents, diploma residents. See sir, there is no syllabus in our course. In a residency, everyone, even a first year, is expected to learn everything which a third year is. But of course, in the first 6 months, we don't have much knowledge, particularly in our subject, which is my subject, slightly difficult subject. We don't tend to study much in our undergraduate days. So I have made the course in such a way that the first year resident, be it MS, MD, he should start with some modules. The first module is the investigations and the basics, anatomy, physiology of the subject. So every topic, whether it's a cornea or retina, the first two subsection videos are based on anatomy, physiology, embryology, and the basics. So first year resident should stress on these. Each topic has been subdivided into various categories, various sub videos. So they can just don't go into all the clinical things, the first year ones. They start with the investigations, that what is the instrument looking like? How do I use this instrument in the clinic? What is the anatomy of this organ? How his cornea looks like? How the retina looks like? So that is, student asked me, so when is the best time to buy? So best time is when you start the residency. That is actually
at that time you are able to formulate the concepts with the teacher himself.
Yes.
Otherwise you will be missing out on theory.
Yeah.
And I believe that even the exam boards have the same philosophy. The paper 1 in every specialty of residency uses anatomy and the basic sciences part of that subject as the paper 1.
Correct.
Even when we go abroad for our membership exams or fellowship exams, even in radiology, the initial paper has to be based on those basics.
Basics and investigations are the first separate paper, even in professional exam and the foreign exams.
And I totally agree. If he doesn't join your course at that time, he will be drowned only by the work.
Yes.
And usually when we don't want to say this, but when we are a first year, we are all pushed down by a lot of donkey work.
Absolutely.
So if you are studying side by side, you are also learning that why am I writing this investigation? What is this instrument looks like? And you get the idea about the anatomy.
Correct. That is the purpose for the first year, sir.
Perfect. And Saurabh, after the first year, when you go to the second year, you have that thesis year.
Yes.
Then what to do and what part of your course becomes more relevant at that stage?
Yeah. So if a student has joined in the first year, now he is well versed with the anatomy, physiology and investigation the first 6 months. Now what he starts seeing the patients in the clinic from day 1, he is expected to see. But he won't be able to understand the signs and the symptoms of the patient just by looking. So when he has a basic knowledge, now second year or third year student, he can just, for example, he saw a patient in a clinic on keratoconus. So he just can go to his hostel or his home and see the keratoconus video. and see what the signs he has seen and what are the signs he has missed in the video, and what management was done by him or his residents or seniors, and what could have been the management. So that is the way of learning the clinical knowledge. The next after anatomy physiology, the next all the clinical subjects, all the clinical topics are given such small videos. So whatever sign they see, they will see that topic in the eMedicoz app, and that will help you to learn simultaneously with the clinical knowledge they get.
And I can actually put it like eyes can only see what the brain knows, and here you have to see the eyes only.
Yes.
So I find it very interesting that residents, when they don't know anything, they say, I am unable to see the sign on radiological image, but if you don't know, how can you see?
Correct.
So the knowledge has to be the backbone of your learning.
Yes.
But when we reach the third year where you have an exam, now not only knowledge, you need to pass the exam.
Yes.
Any changes in how to utilize the course in the third year?
So all the clinical topics which I have touched, I have made in such a way that will help you to write the exam in the professional exam. Plus, that will help you in practical viva as well, because I have given during the teaching, I have given that this part can be a viva voce question. This can be asked to you in the exam. And students have told me that is very helpful for them in writing the exam as well as in practical exam as well. That will help you in the third year, last 6 months of the course.
And so, I have a very important question here. Is there a difference between MS and DNB final exam? Like if I'm a third year in DNB,
yes,
like how my approach, because now theory becomes a very important part of my life.
Yes.
I want to pass the theory exam. How does your course help me in DNB theory exam?
So there's no difference at all. I mean, in the exam, theoretical exam, the MS, DNB, or even the diploma exam, they are absolutely same. They are giving the clinical scenarios and which you learn in the course in a structured way. I don't think so there is a difference. Though yes, in the practical exam, in the DNB, they go into various one-liners. Whereas in MS exam, they give you approach clinical scenario-based questions. So that is one difference in the practical. But theory-wise, I don't think there is a difference.
And Saurabh, do you help the students with the updates also? Because updates are an important part of the exam as well as your life. When I join my MD and when I exit, things would change. They will evolve. Guidelines would change. Do you help with those updates?
So there is a module known as recent advances in my course. So everything which has been changed has been added as a recent advantage and which is going on. So I'll give you a very simple example. There is a retinopathy of prematurity is an important topic. So at that time, I gave a video and theoretical, practical, everything in retinopathy of prematurity, but the classification changed. That is known as ICA ROP, if you know, International Classification of ROP 3. So that 3 part and what are the changes have been added in the recent advances. Awesome. With the basics in the main video and the advances in the recent advances section.
Saurabh, if I think like a resident, now after I finish my MS or DNB Opthal, now I also want to do further. I might want to go abroad to pursue a FRC path, or maybe I want to do some fellowship in a premium institute or a senior residency in a premium institute. Does your course help them, in those entrances or getting into those exams or passing the exam? Any thoughts on them, and do you guide them for them?
So first is foreign exams, like we have FICO, International Council of Ophthalmology, then FRCS, MRCS. So they have different steps. As Sir said that even in ophthalmology, the first step is always a basic investigation in optics. So my course I have made in such a way, like optics course is purely based on Elkington book. And that Elkington book has MCQs and theory. My course on optics, module on optics is based on that. So that will help you in that FRCS, FICO opthal exam. The entire course I have based as a basic book, which is Kansky, which is a standard book for ophthalmology as a basic book. But as we go on, residents want more and more knowledge. So after getting a basic knowledge, the cornea topic, most advanced things I've made from a book known as Crackmer, which we don't study in even I didn't study Crackmer book and very big books in residency. We study Kansky and some things. So I've made the topics in such a way that even if the student is not able to read in residency books like Crackmer, Ryan, Retina, Jacobi, and Shields and glaucoma, they have that knowledge in that video in a small, concise way, and that will help you in the foreign exams as well, like FICO, FRCS, MRCS exam. Plus in the fellowship has a basic MCQ as a screening exam. So I have a book, Nephrology, sir, which we have launched last year. So one I've included that in my course, that you can see in the eMedicoz app. You can solve MCQs, and I've color coded the red ones as the difficult ones for residents which we have updated now in the eMedicoz app also. They can actively solve eMedicoz. So for screening exam in fellowships, they can solve the MCQs, plus Viva, of course, they can have a clinical knowledge.
And all said and done, as a resident, I have a question that am I in the right place? Did I make a right choice by getting ophthalmology? And is it like my career is, how do you see when you look back now? Because this question has different answers in different stages of our life.
Correct.
And you are a role model for many ophthalmologists, budding ophthalmologists. When you look back now, what is your idea?
So our ophthalmology subject, even I didn't have the first choice in ophthalmology. My rank I was from AIMS, my rank was 47. So I was getting surgical branches. And of all the surgical branches which I was getting, surgery, obs gynec, MCHN, I chose ophthalmology, but that was not my first choice. Now also many students don't have, unless and until we have a family history of ophthalmology.
Yeah.
But I don't think like this. Every subject, if you do well, and you can do well in any subject, whether it's non-clinical subjects also, even in PSM anatomy, if you do well and you can excel in. So I don't have this, but this is in hindsight, sir. We don't understand this just after MBBS. When you do well in any field, I think field doesn't matter, and individual matters, and how you will do well in your life.
That's true, actually, and dots always connect when you look backwards. When you look forward, you are not aware that why things are happening, but one day you look back and you're happy that the things unfolded the way.
Correct.
So on that note, I wish all the future ophthalmology residents and the current residents and the practicing ophthalmologists a very best of luck from my side, and I leave Dr. Saurabh to give you a final message for all the residents.
My final message is don't think that I have taken this subject and what will happen. So many investment is there. So many questions a student asks in joining this. You can start from basics, start from very basic setup. But in the residency, the main thing is academics. If your academics is strong in residency, surgery should be basic one. Surgery you will learn in fellowships. So academics is the one thing which I always stress one should learn in 3 years of residency, because after that you will not study. You will just go surgery. So academics is the one which I will stress again and again. And this is the time when you have to make your basics strong. Best wishes from my side. Thank you, sir, for calling me.
Thank you, Saurabh. And final words from him: skill and knowledge nobody can take away from you. Residency is the time to get skill and knowledge. Once you have it, you will always win. Wish you all the best. याद रखना, अपना टाइम आएगा नहीं, अपना टाइम अपन खुद लाएंगे.